The neurodynamic approach we use in the clinic isn't just generic nerve sliders. It's about how the nervous system moves and functions inside the body. Your nerves aren't static. They need to slide, stretch, and adapt as you move. When that gets affected because of injury, inflammation, or restriction, you can get pain, tingling, numbness, or weakness as a result. That's where neurodynamics come in. This approach is mainly based on Michael Shacklock's work. It looks at how the nerves function in relation to what's around them. We assess the nerve itself and the tissues it runs through, like the muscles, joints, fascia, etc. Once we identify the problem, we use targeted techniques like mobilizations, tensioners, or what we call openers. They all have different levels within them because the most important thing is that you don't want to further aggravate a nerve that's already sensitive. So you have to make sure what you're doing matches exactly what the patient needs. Openers help us create more space around the nerve. Mobilizations or sliders, they gently move the nerve back and forth to improve mobility. Tensioners apply more stretch when needed, typically done later in the rehab, once the system can handle it. We often have to combine this with other clusters of orthopedic and neurological tests because sometimes the problem isn't the nerve itself, it's what's pressing or tethering it. Muscles, joints, fascia. This is not a cookie cutter protocol. It highly depends on all these different factors. So if you've been dealing with nerve pain that's not improving, it might not be just about the disc or the joint or the muscle. It could be how the nerve is moving or not moving through that whole system. That's what we assess and that's what we treat.